Hello and welcome to Faye's Journey in Ghana. This is week 6. I'm working as a nurse over here and a couple of people have asked me what I'm doing, so I thought I would talk a bit about 2 cases that we dealt with yesterday when I was working with one of the doctors. The patients use the hospital as what we would call like a GP service, like a family doctor. Excuse me. So yesterday, 2 of the cases that came in, one was a 4-year-old boy. I have put a couple of images up to accompany this post. If you click on my channel with my smiling face and then go along to post, you'll see an X-ray and you'll see scan results. The X-rays for the boy. So 4 years old, failure to thrive, as we would call it, so thin. He looked like the children in the Live Aid video, starving children in Africa. He just didn't look well. He was just sitting with his mum, not interested in what's going on. What made it more obvious was that he's got a twin brother who's a big, healthy lad, and one twin was just sitting on his mum's knee, lethargic, not interested. The other twin was wanting his mum's phone, was talking to his dad, behaving as you would expect. So the child needed admitted, and we got tests done. We got the chest X-ray and bloods. You'll see the chest X-ray, and on a chest X-ray you should see the ribs and there should be black spaces for air in between, and that's a normal chest X-ray. On this X-ray you'll see it's all cloudy because he's got fluid in his lungs. So we got started on IV antibiotics yesterday. He's got pneumonia, but we don't know why, and we don't know why he's lost weight, why he's not got an appetite. His parents had taken him to a couple of other hospitals. We don't know what tests were done there. He could have tuberculosis. He's probably got malaria, because a lot of people have malaria here, and that may be why he's not eating and losing weight. He might be HIV positive. So there's a whole range of diagnoses, but the main thing is we got him started on treatment yesterday, and he'll be feeling better once he can breathe better. He coughed a couple of times, I noticed, and he was slightly breathless, not badly, but just obviously breathing as opposed to just the way everyone else breathes. So that was the first admission we got yesterday. The second chap we saw that was significant was a man in his 50s, big healthy looking guy, walked in complaining of lower leg pain in both legs. The doctor asked to have a look at his legs to see if there was anything to see. I was thinking maybe a wear and tear thing. A lot of the people here are in the farming community and they get arthritic changes, which is what you'd expect of somebody who works outdoors and works hard. And the doctor put her hand on his calf and it was hot and it felt hard. And I just knew by her face, as soon as she put her hand on his leg, she looked at me and I looked at her. And she said, "What do you think?" And I said, "Has he got a DVT?" And she said, "I think so." So he got sent away for a scan and an X-ray and came back to the consulting room with the results. And you'll see the scan results, and it does confirm a DVT. In case you don't know, a DVT is a deep venous thrombosis, which is a blood clot in one of the veins, usually in the lower leg. The risk is if that clot moves and goes to the lungs, and then you get a pulmonary embolism, which is very serious. So it was good that he came early, and he got started on blood thinners, painkillers, and he got compression stockings, which are these horrible tight things that are difficult to pull on. But he was so grateful for the help, and you have to pay for your hospital care here, so he had to pay for the scan and the X-ray and his 2 medications and his compression stockings. But he was glad that he came, and I said to him, "You did the right thing coming in," because his English wasn't bad. He was a lorry driver, so we had to say to him, you won't be able to drive. And he was speaking in a can, but I could see he was saying, "But I work for a living." And I said to him in English, "If you carry on driving, this is going to get worse, and you won't be able to drive at all because you'll be disabled, or it could be the end of things for you." And he said, okay. So hopefully we helped him, and he's coming back in 2 weeks and we'll review him. I think he's 3 weeks on his blood thinners. So that was a good job. So 2 interesting cases today, and you'll see the posts to help along.